Joe, Sigil looks like you now. Hey,
I know, man.
Hey, we are live.
You saw me, man. I told him I just looked like.
We want to prove we're on the road. This is now we're on 10. We are headed to Houston. But while we're on the road, we're connecting with our dear friend, Joe Alukal. He
one of the premier leading
urologists, and actually, I was his medical student. And I think his opinion of me has changed since then. Thank God. I was not the best student. I think you were a fellow,
the only
right?
part about that story that makes me sad, it reveals how old I am. That you were my medical student when I was almost done training makes you feel so old.
Hey, Joe, now you understand what I have to deal with on a daily basis.
Yeah,
So you can tell what I'm dealing with.
I get it.
All right, so Joe, you mind telling us where you are right now? You were showing me earlier before we went live. I would love to see it and hear about your space over there.
Sure. I am at the Preston Robert Tisch Center for Men's Health in Midtown Manhattan. This is one of Langone's, NYU Langone's flagship facilities. And it's run by Dr. Stephen Lamb, who's a great friend and a great collaborator. He's around the corner. An internist with a tremendous experience in low testosterone and men's health. He's been in practice in New York for 30 years. And so I'm one of, I think now 27 doctors who come through here. And so a couple other urologists, but we're totally multi-specialty: cardiology, gastroenterology, endocrinology, psychiatry, dermatology. We have a PT facility. It's a beautiful space. Like I could, one of these days I'll walk you guys through it. But you know, if I go out there now, it's still chaos because the place is busy.
So when a guy comes, does he just come for like the full tune-up, everything, all 100-point inspection, or is it
certainly we have the people who will show up and sort of, you know, block out their whole day and just see everybody. Kind of variation on the executive physical. And then as well, we have the patients who come in and, you know, if somebody sees me and I figure out that they need to see a cardiologist or they need to see the endocrinologist, for example, I can get that done same day, which is always a joy. And of course, the opposite is true. There's plenty of guys who come through and these guys figure out quickly, hey, wait a second, he needs a urologist. And they'll put them on my doorstep. So I mean, it really, I think for quality men's
you must
health,
have a lot of that all day.
A lot of what? I'm sorry. Yeah, I know. You know, it's not exactly the most like sort of regimented schedule, but you know, as well, people are so appreciative. And so it makes for a real difference in terms of the interaction you have with people.
Yeah. I guess it's quality over quantity, right?
Yeah, of course. You know, you'd love to be able to do this everywhere.
And so, do you think, Joe, in general, like the way we practice medicine right now, this is kind of a model of the future in terms of personalized, kind of patient-oriented kind of healthcare?
I certainly think this sort of facility is the kind of place that can lend itself to that sort of approach, to that level of care. The idea that as we have better tools to offer people in terms of personalized medicine, genetic testing, personalized treatments, you will want to have everybody's doctors under one roof.
That's right. And so, Joe, you know, for the average person out there who's listening in and watching this, you know, I think it'd be kind of cool. Could you walk them through, like, see you in New York, or they have an issue? What are the kind of issues you deal with, and when they approach you and stuff? What's your methodology, and what are some of the treatment options?
Sure. So, I mean, one of the things that I think is most important and is brought to the forefront in a place like this is an emphasis on prevention. You know, the majority of the patients.
Are you covering your microphone? Joe, are you covering your microphone? Are you on your phone?
Can you hear me better now?
Yeah.
Yeah, it's a little bit better.
Okay. Sorry, my friend.
No problem.
So the conditions that I'm probably seeing patients the most for are hypogonadism, male fertility, and male sexual health.
So that's like low and just for the average audience out there, so low testosterone, problems with having babies, things like that.
Right, exactly. And so
Can you prescribe me some testosterone, Joe? Right now.
The guy sitting next to you can just fill up a syringe with about 5 milliliters of injectable testosterone and jab it straight in your neck, and we're gonna have everything solved in about 2 seconds. But the idea that every one of those conditions is associated with other medical problems that patients need to know about. And families need to know about. And so in this sort of a setting, I can absolutely make sure that people are worked up completely and in a very prompt fashion and without a lot of hassle. So I love that part of it. I absolutely love that part of it.
That's awesome, yeah. So let's say I come in, and I'm a dummy patient or demo patient, so my testosterone's really low.
Yeah, what is a low testosterone? I get this asked. We got this asked like 10 times. We did a parade on Bourbon Street, and guys were like, "My testosterone's 400. Should I get injections?" And then we're like, "No, you're also 500 pounds." So I had to kind of had a discussion with them, and because most doctors are patients that are overweight, they're afraid to say some of the realities. It's easier just to give them pills, but that's why things like what you have going on is someone's probably telling them you're overweight. Go see the endocrinologist and go see the urologist for all these things. But for everyone, and there's a lot of controversy. Would love to hear your insight on it and who is a true candidate and what is the number or your cutoff.
Sure. I mean, that question is clear as mud, the answer. There's so much gray in terms of who truly needs to be on testosterone. How do you make the diagnosis? The only thing you said in there that I was absolutely sure was a great idea is we need to start a clinic on Bourbon Street. I mean, that will be the busiest men's health clinic on the face of the earth.
Absolutely.
But I try to think about it differently. I feel like when we're talking about problems with testosterone, we're talking about one of the most common health conditions affecting half the population. And it has a tremendous number of health implications in terms of somebody's well-being, their longevity. And so what we simply need to be doing is doing a better job of studying the condition, diagnosing the condition, and treating the condition. Because if we do that, we'll be better able to answer your question, which is who should be on it, who shouldn't be on it, how much should they be taking, what can they expect, what can I expect. So I'm constantly making this point now when I meet with scientists, patients, donors, philanthropists, that this is an incredibly important public health issue affecting half our population. Why aren't we doing a better job studying?
Because men, and we talked about the other surveys. I mean, men don't talk about it, and men aren't really advocates for themselves, and that's why we hit the road. What you do in your men's health center is starting that communication with men. You'll love this. We did a survey this year through Orlando Health, and we found that 4 out of 5 men have never talked about their sexual health when they should at a young age. They never talk about STDs, HPV, HIV, protection, fertility issues. And family history and all that stuff, so that they just don't know when they're supposed to start to see a doctor because they don't know what their risks are, never talked about it. Whereas 90% of women, surveyed people, have talked about this. And I think the communication gap doesn't start when they see us in the office. It started 30 years before that when they were young and healthy.
Yeah, that's completely correct. I think the biggest difference between men and women on this front is the fact that women get plugged in with a gynecologist at a young age.
before that, they
And this
get plugged
becomes something
in with a female figure in their family when they start having
Right.
their menstrual cycles.
right. And this
You know,
becomes
that's
just a
that's
part
the thing
of
that
their
first
life.
starts.
Whereas we, there's
Don't
no
Jewish guys
compromise.
did the same when they got their first? Don't Jewish guys did the same thing when they got their first erection? Like, I'm not trying to be funny. I'm being serious.
Except that event generally occurs with a diaper change, like age 1.
That's true, Joe. Touche, man.
But yes, I absolutely agree. Somewhere along the way, we need to get these young men talking to people.
A young patient comes in with low testosterone. Well, what's your workup look like, and what are you looking for?
So certainly a thorough history and physical exam. Does he have any medical conditions that might explain this? Or medications he's taking? There'll be a hormonal evaluation, including other hormones that might explain a testosterone problem. Young man, almost always, I'm going to go ahead and get a semen analysis. And so then the question is, did we uncover something that could explain a low testosterone? Does he need to be
That's
on
interesting.
testosterone?
So if you see a young guy, if you're seeing a young guy, you're going to get a semen analysis part of it. That's interesting.
Yeah. That way,
Yeah,
just
almost as a reflex.
the pause, right? It's a global
That's
phenomenon. Just absolutely.
Yeah.
Do you offer banking for some of these individuals if their levels are low and stuff?
Exactly. So if the guy really does need to be on testosterone and he hasn't yet had his kids, I'll suggest that he bank sperm.
Yeah, just as a safety security measure, right?
Yeah. Well, I mean, you never know how long he's going to be on testosterone for. Maybe 2 years or 20.
Yeah, that's true. That's true.
That's good. That's good.
That's excellent. And so, and then you mentioned sometimes you'll get a cardiology visit that day. So what triggers you onto that? What would you see that would trigger a consultation to the cardiologist?
Sure. That's usually an older patient. Imagine a guy in his early 50s who doesn't have any regular medical care, and he has erectile dysfunction. I'm absolutely going to tell that guy, look, man, I'm happy to treat the problem, but I also want you to get cardiologist.
Yeah, I actually won't even give them testosterone or their Viagra until they see them, and they get upset with me. But if I give them the candy, they're not going to go see the other doctor. So I limit it until they do it.
That's right.
But I sleep better knowing that I got them the appropriate workup and the full workup, and they thank me later on when they.
Absolutely. Yeah.
That's good, brother. So how can our viewers find you, man? Obviously, I know you have a radio show, Dr. Radio, that you're on.
Joe, how would a patient who's trying to get information about you, some of these topics, they contact you?
Sure. So they're always welcome to tune into the show. It's the Men's Health Show on Dr. Radio, Sirius XM Channel 110. And it's Wednesdays from 6 to 8 Eastern. And they can follow me at Dr. Joe Alukal.
Awesome. Well, Joe, thank you so much for taking the time to speak with us today on the road. And it's been a great conversation, and we hope to continue it. And I think next year we're going to stop in New York again, buddy, so get ready.
Yeah, man, you got to give me a good warning before you come up. Where are you guys right now?
I will. We're going to give you more than a 2-day warning like we have in the past. So.
Thank you.
Hey, Joe, thank you very much, man. Hope you have a great rest of the day in the office and a great week.
You guys be well. Safe travels.
Thanks, Joe. Thank you, buddy.
Take care.